One day, this global pandemic will subside. But I do not expect COVID-19 to disappear. It will remain with humankind and become endemic. The virus will continue to circulate in pockets of the global population for years to come. This also means we'll see small outbreaks of the disease from time to time in Singapore as well. In this new normal, we'll have to learn to carry on with our lives, even with a virus in our midst.
Professor, could you help us paint what this new normal will look like in terms of Singapore's public health policies and even on the individual level as well?
Actually, I think at this point it's useful to think back to what has happened with polio, with measles, with mumps, with whooping cough, which we also call pertussis, diphtheria, and tetanus. These are some of the infectious diseases that the world were grappling with many decades ago. And I suspect many of these diseases are what younger generations of Singaporeans may not have heard about, but they would already have received the vaccination against these infectious diseases. But these were exactly the kind of problems that used to plague individuals and communities and countries many years back. And I suspect this is going to be what will happen with COVID-19 as well. That right now we are in the midst of it. That's why we feel the trauma, the pain, the worries with an infection like COVID-19. But vaccination is very likely to be the solution that will take us out of this, because once we have more people vaccinated, perhaps this will be an annual vaccination, like very much some of our vaccinations that we roll out. When we have enough people vaccinated, we will be able to relax our measures, because even if I'm vaccinated and I get infected when I'm vaccinated, my symptoms are likely to be mild and very unlikely to require hospital care. And that means that we can now lift a lot of our restrictions, perhaps even resume some degree of travel to places where the degree of vaccination in those countries are similarly high. And I think that would be the new normal that we're looking at, relying on vaccination with some public health measures that will still be in place to make sure that we minimize the risk of transmission if indeed someone is infected but asymptomatic.